Thank you very much. So as Joanna said, I'm Kerry Dwan. I lead the Methods Support Unit at Cochrane. And today my presentation is looking to find clarity in complexity. And we're looking at an introduction to the concept of network meta-analysis. So hopefully by the end of this presentation, the complex idea of network meta-analysis will be a bit more clear to you. The outline of this presentation will be, we'll talk about what a network meta-analysis actually is and why we should use one. And then we'll look at some examples. And then we'll look at the network meta-analysis framework, including the assumptions, which are really important when thinking about network meta-analysis. We'll look at some key quality markers and a protocol template, and then I'll go through a worked example, and then I'll direct you to some other resources and references. So I'm hoping most of you know what a systematic review is, but for those who aren't aware, a systematic review collates the empirical evidence that fits pre-specified eligibility criteria in order to answer a specific research question, following PICO, which stands for Population, Intervention, Comparator and Outcome. It uses explicit systematic methods so that bias is minimized and the findings are reliable and conclusions can be drawn from these and decisions made. A meta-analysis is the statistical combination of results from two or more separate studies comparing two health interventions, for example, drug A versus drug B. So you can see here the forest plot on the slide, and we have the two trials included, and the squares represent the treatment effect from those trials, and the line is the confidence interval. And the diamond is the pool treatment effect estimate with the confidence interval. So you can see here we've got an odds ratio of 1.85 with the confidence interval. So that's pairwise meta-analysis. Network meta-analysis, as Joanna said, is a technique for comparing three or more interventions simultaneously in a single analysis by combining both direct and indirect evidence across a network of studies. And the diagram on screen now shows you an example of a network. So the question is, why should we use one? Well, empirical studies have shown that the most critical question raised by patients and clinicians at the point of care is, what is the treatment of choice for the given condition? And network meta-analysis has been used to answer this question for over a decade now. Some examples of network meta-analysis in the literature. One is the COVID NMA initiative, and this is a living systematic review of COVID-19 trials. And this is constantly updated with new data from trials. And then we have in the Cochrane Library, one example is behavioural interventions for smoking cessation. And this review includes 312 trials with 250,000 participants and 845 study arms. Drugs for preventing postoperative nausea and vomiting in adults after general anaesthesia includes 585 studies with almost 100,000 participants, and it looks at 44 single drugs and 51 drug combinations. And we have uterotonic agents for preventing postpartum hemorrhage, and this includes 196 trials, 135,000 women, and has 7 uterotonic agents and a placebo or no treatment. So you can see there, the size of some of these reviews is very large, looking at many trials, many participants, and many different types of interventions. So looking at the hierarchy of the evidence, we have non-randomized studies, then we have randomized trials, then systematic reviews with meta-analysis, and then network meta-analysis of randomized trials. Other names for network meta-analysis in the literature include multiple treatment meta-analysis and mixed treatment comparisons. So thinking about the simplest network meta-analysis, we have one trial that compares treatment A versus B, and another that compares treatment B versus treatment C. So to give us indirect evidence via treatment B, we can compare treatment A and treatment C. There may be also trials that compare A to C head to head as well. So we could have direct evidence of A versus C. So we can combine the direct evidence and the indirect evidence to obtain a combined or mixed treatment effect. So this will be the result of the network meta-analysis. An example given in the Cochrane handbook is one trial that compares doctor versus dietitian and another that compares dietitian to nurse. And indirectly, we can actually compare doctor versus nurse. So the validity of an indirect comparison requires that the different sets of randomized trials are similar on average in all important factors other than the interventions being compared. So there are different ways of thinking about transitivity. So treatment A must be similar when it appears in the different trials. So if it is similar, the transitivity assumption has been satisfied. However, if treatment A is a placebo and it's given in different forms, for example, injection versus a pill, then it may be that the transitivity assumption is not satisfied. So it might not be appropriate to undertake a network meta-analysis. We also have to think about the distribution of a potential effect modifiers. So we need to make sure important effect modifiers are balanced across the different studies. So here you can see the age range in placebo versus B and the trial placebo versus C are similar. So that's okay. But in the bottom example, the age range is quite different in the two different trials. So in the bottom example, the transitivity assumption may not be satisfied. So when we're starting to think about conducting our review, we need to make sure the treatments that are jointly randomizable in principle. So so it could be theoretically that any of the participants in any of the trials could have been randomized to any of the interventions. So if there'd have been a mega trial including all of the interventions, for example, the participants could have been randomized to any of them. And then when we actually look at the studies, we need to compare them and make sure the effect modifiers are balanced across the different trials, as I've just shown in the example with age. And then the statistical manifestation of transitivity is called coherence, and it's also referred to as consistency in the literature as well. And this is when making sure that direct and indirect estimates are in statistical agreement. And there are different tests that can look at that, and I will talk about that a bit later. So with network meta-analysis, you would still go through all of the key stages in the review, but there's just a few additional things to consider. So you would still have a pre-published protocol with a well-defined question, and you'd want to justify why a network meta-analysis is needed. Excuse me. In your objectives, you'd want to explicitly state that you're going to conduct a network meta-analysis. And if ranking is an objective as well, you would include that. And I'll talk a bit more about ranking later. The inclusion and exclusion criteria needs to be clear. And when you're thinking about the inclusion criteria, you need to think about transitivity as well. You should explain the selection of the interventions. So it's important to define your interventions in advance and think about how you're going to deal with different doses and administrations, for example. Comprehensive search strategy is also important, and using existing systematic reviews to identify eligible studies rather than conducting a new search is usually inadequate. You would still have dual study selection, data extraction, and risk of bias assessment. And it's important to have well-defined study characteristics, again, thinking about the transitivity assumption. And then when we get to the data analysis section, some people have subheadings here. So they have pairwise meta-analysis if they're going to conduct pairwise meta-analysis, and then a subheading for network meta-analysis as well. And it's important to specify what models and framework that you're going to use in the data analysis section. And I will talk a bit more about that later. And it's also important to think about the presentation of the results, because often we see reviews with network meta-analysis with up to 100 maybe different tables and figures as well. And obviously this can make it quite difficult for the reader. So we suggest that the tables and figures that aren't directly necessary for the review, they could be included in an online repository. So it's just important to think about presenting the review findings in a clear and concise way. And it's also important to have minimal, well-justified protocol deviations. And just to say as well that there is an extension to the PRISMA statement for network meta-analysis in what to report in the review. We conducted a study looking at protocols using network meta-analysis that was published in the Cochrane Library in 2018 and 2019. And there were 45 protocols included. And as you can see here in this plot, there's a variety of ways that the items were included. So the things that were included well is we have 96% reported the statistical software that they used, 98% considered reporting bias, and 95% justified the need for a network meta-analysis. However, only 53% considered the transitivity assumption, which I've already said is a really important part of network meta-analysis. Only 56% reported the model choice for network meta-analysis. So in conclusion, the protocols reported multiple items well, but there is room for improvement. So one of the things we did was to create a protocol template, and this should be available soon on Cochrane's knowledge base. It's not a cut and paste template, so it tells you exactly what to write in each section. It just directs you for what to think about for each section. So for example, and why it's important to do this review, we say the authors should specify their rationale for undertaking a network meta-analysis. And we give examples of strong reasons for this. So you would need to relate that to your particular review and back that up with justification. And then in the objectives, this section should explicitly state that a network meta-analysis will be conducted, and also ranking if that's an objective as well. So the example I'm going to go through is uterotonic agents for preventing postpartum hemorrhage. This was updated to include a large WHO trial, and it was funded by the NIHR. And it had a mix of clinical, methodological, and statistical experts. And the literature search was performed by an information specialist. So it is important to have expertise on the team. So first of all, starting with, is a network meta-analysis justified? And they have considered this here. They've said, in the absence of a single randomized controlled trial comparing all available uterotonic agents, uncertainty remains over their relative effectiveness and ranking. And then it goes on to talk about network meta-analysis as well. Some of the appropriate rationales include the availability of many independent comparisons, the absence of head-to-head comparisons, the need to resolve inconsistent findings, and the need to rank available treatment. But the most important rationale is that the review addresses a question involving multiple interventions. In the background as well, it also specified that the WHO recommends that all women giving birth should be offered uterotonics during the third stage of labour for the prevention of postpartum hemorrhage. So this is starting to think about the transitivity assumption and that it's applicable to this review. As I mentioned before, it's important to think about the transitivity assumption in the inclusion criteria. And the authors have done this here by stating that for this review, we assume that any woman who meets the inclusion criteria is in principle equally likely to be randomized to any of the eligible uterotonic agents. So if you remember before, I mentioned this is one of the important parts of transitivity, to make sure that in theory, the women could have been randomized to any of the available uterotonic agents. It's also important to make sure, when you're thinking about the interventions, that you have enough so that the review is comprehensive and answers the question, but also that it's small enough so that the review is clinically meaningful as well. And you need to think about lumping and splitting the nodes of a network. So the nodes are the different interventions, and you need to think about how the different doses and administrations and whether you're going to have them separate or put them together. And also you need to think about unspecified interventions as well. So when you perform your search, you might come up with trials that haven't looked at any of the interventions that you've mentioned, but the intervention is relevant. Maybe it's not used as often, and you need to think about how you will include those. Will it be a post hoc decision? So this is the network diagram that I showed you before, and this is for the outcome of postpartum hemorrhage greater than or equal to 500 mils for the uterotonic agents review. And the nodes, which are the circles, the interventions, the size of those represents the number of trials comparing this intervention to others in the network. So you can see the interventions that were considered most, misoprostol and oxytocin. And the lines connecting each pair of interventions represent a direct comparison, and are drawn proportional to the number of trials making each direct comparison. And in this diagram, we have numbers on the lines as well. So this isn't always included in a network diagram, but this shows the number of participants and the number of trials that are included for this comparison. And then there's also the colours as well of the lines. So green represents high certainty evidence, orange is low certainty, and red is very low. So when we go on to data synthesis, as I mentioned before, they've included subheadings. So one for direct treatment comparisons and one for indirect and network comparisons. So not all reviews with network meta-analysis will undertake pairwise comparisons separately. They might just do it as part of the network meta-analysis. We need to make sure that you think about the statistical model that you're going to use and whether you're going to look at a Bayesian or frequentist setting, and whether you're going to use a fixed or random approach. And make sure you account for the correlated nature of multi-arm studies. So when studies compare more than 2 interventions within that study, and think about the assumptions about the heterogeneity variance as well. And if a Bayesian framework's used, there are additional technical details, such as details on the prior distributions and convergence of the Markov chain Monte Carlo approaches should also be described. This is where a knowledgeable statistician is really important for the team as well. There are different software that are available to undertake network meta-analyses, and these are some of the ones that the Cochrane Comparing Multiple Interventions Methods Group recommend are Stata, Winbugs, for example. And the two on the other side are relatively new. So we've got NMA Studio and Meta Insight, and these are websites where you can upload your data, and the website will undertake the network meta-analysis for you. So then thinking about incoherence, it's important that this is considered in the methods section and the results as well. So there are 2 approaches to this, global and local. So global approaches evaluate incoherence in the whole network. So it looks at the whole network as one, and design by treatment interaction models is one way to do this. And as you can see here in this example in the methods section, they mentioned design by treatment interaction model. And then another approach is a local approach as well, and that looks at individual loops within the network to see if there are any hotspots for incoherence. And although it wasn't mentioned in the methods, they do mention using local approaches in the results as well. So it's making sure the methods in the methods section is consistent with the results section. So going on to the effects of interventions, it's really important here, as I mentioned when we were talking about the examples, the number of trials and participants and different interventions that are often included in some of these reviews, it's really important to present the results in a concise way, so it's easy for people to read. And one way to do that is with a league table. And this isn't from the Uterotonics review. They presented their results in a different way, which I'll show you in a minute. But a league table is a really useful way of presenting the results. So the different interventions in this table are colour coordinated down the diagonal. And the results from the network meta-analysis, the relative effect with the confidence interval, are presented in each of the boxes here. And the results in the top right triangle are usually the results from the direct estimates. So if you wanted to compare the purple intervention here with the blue intervention, you'd find the corresponding square. So here it would be, the relative effect would be 29.33 with the confidence interval. And they've also color coded the results here, it seems, so that the grey highlighted squares are statistically significant as well. So this is the way the Uterotonics review presented the results. And you can see here, they've got the different interventions. So here we've got oxytocin versus placebo or no treatment, and they give you the direct estimate, the indirect estimate, and the network estimate as well. And we have those on the forest plot, and the risk ratios presented with their confidence intervals. And they've done that for all of the different comparisons in the network meta-analysis. And then thinking about coherence as well, you can see here that the direct estimate and the indirect estimate both are in the same direction, and the confidence intervals overlap. So for this particular comparison, we wouldn't be concerned about incoherence. It's also important to think to write about the heterogeneity and incoherence in the network. So here they've said there was evidence of global inconsistency in this analysis, where the direct and network randomized evidence were not in agreement. So this isn't quite correct, because they should be comparing the direct and the indirect evidence rather than the direct with the network as well. Treatment ranking is also an option for reviews with network meta-analysis, although just as it's noted on the slide, as a caution, ranking measures aren't substitute for the relative effect estimates. So relative effect estimates also need to be presented. And there's a recent paper by Georgia Salanti and colleagues that state that network meta-analyses that aim to rank treatments should state the treatment hierarchy question they aim to address, and then employ the appropriate ranking metric to answer it. So in the method support unit, we're used to seeing reviews that just say that they're going to rank all of the different outcomes, and they're going to use one specific ranking metric to do that. But it's not actually clear what the question is they're trying to answer. So one question, for example, might be that you're interested in which treatment is most likely to improve mean survival by at least 2 years. So if that was the question you want to answer, then you need to go to the right ranking metric in order to answer that particular question. And you should avoid ranking when there's lots of uncertainty in the estimates, or when there's important differences in the uncertainty across comparisons as well. So this is from the Uterotonics review, and they've used Sucra, which stands for surface under the cumulative ranking curve, and they've presented it in a rankogram here. And as you can see, these ones at the top are the highest ranked for the postpartum hemorrhage outcome. And the question that the Sucra is trying to answer is, which treatment has the largest fraction of competitors that it beats? And as you can see here, we've got ergometrine plus oxytocin is the highest ranked for this particular outcome. So as I've said, it's really important to be able to present the findings in a concise way. And so for this particular review, in the abstract, it states that the relative effects from the network meta-analysis suggested that all agents, all the uterotonic agents, were effective for preventing postpartum hemorrhage when compared with placebo or no treatment. And it talks about the 3 highest ranked uterotonic agents and states what they are. And it also presents data on other outcomes as well. So misoprostol plus oxytocin reduces the use of additional uterotonics. And here it presents the treatment effect with the confidence interval and also the certainty of the evidence. And it probably also reduces the risk of blood transfusion when compared with oxytocin. And the 2 combination regimens were associated with important side effects. This is another recent paper published last year, Robman, or Rob, MEN. It's a tool to assess the risk of bias due to missing evidence in network meta-analysis. And the uterotonics review was updated in 2020, I think, so it hasn't incorporated this particular method. But this paper shows you how to assess for bias due to the presence of studies with unavailable results, so selective reporting. So some studies may have been included and not measured the particular outcome but not reported it, and also to look for the potential for unpublished studies as well. So I think going forward, this will be a really useful tool to assess for selective reporting and publication bias. Another method is the construction of a comparison adjusted funnel plot. So some of you may be used to seeing these in standard intervention reviews, and this is very similar. It's just that it has the different comparisons color-coded on the plot as well. But like other funnel plots, there are multiple reasons for asymmetry, not just publication bias or small study effects. So just be cautious in the interpretation. So it's still important to assess the certainty of the evidence for network meta-analysis as well. And there are 2 approaches, there's grade and cinema. And the confidence in the combined comparison or the result from the network meta-analysis, it depends on the confidence in the direct estimate and the confidence in the indirect estimate as well that contribute to the combined estimate. And the confidence in the indirect comparisons actually depend on all of the pieces of the direct comparisons that contribute to that as well. So it can seem a bit complicated, but it's quite straightforward. The 2 approaches, though, they do differ in the way they combine the considerations when thinking about the indirect and the combined comparison. So we often get asked which approach we should use. Well, the Cochrane Handbook does describe both approaches, and there are no empirical studies that actually compare both approaches. So it suggested that the grade approach, also referred to as the Puhan approach or Bridger-Dello-Peterson, because they extended the grade approach to network meta-analysis. So when indirect comparisons are built on an existing pairwise meta-analysis, which have already been rated with respect to their confidence, you should use that approach. However, if the body of evidence is built from scratch, or there are a large number of comparisons, then you should use cinema. It's also important to think about the summary of findings table as early as the protocol stage, because as you've seen, as I've mentioned before, several times, the size of these reviews, there could be a lot of comparisons to think about. So the Cochrane Handbook does suggest that if there's more than 5 interventions, it could be useful to select and report a reduced number of comparisons as well, but you should justify this choice. So it could be the most important for clinical practice, for example. It's also important to think about the structure of the summary of findings table. As many of you may know, in a standard intervention review, the summary of findings tables are done by comparison. So for each comparison you include, you would have one table with up to 7 outcomes. But for network meta-analysis, it's suggested in this paper by Yepes Nunes that the summary of findings tables are done by outcome. So you can see here the outcome is prevention of advanced neoplasia, and then you would choose the comparator, and then you'd list the different interventions as well. So it suggests that the reference should either be placebo or gold standard treatment, most cost effective, or the least effective intervention. And again, this really should be specified in the protocol and justified. So you can see here, we've got the different interventions in the first column, and then the relative effect from the network meta-analysis included, the certainty of the evidence for that network meta-analysis estimate. And it also includes ranking in this particular table as well. This is the summary of findings table for the uterotonics review. So you can see here, we've got the outcome postpartum hemorrhage greater than or equal to 500 mils. And we've got the comparison, the reference they've chosen to use is oxytocin. And then it lists all of the other interventions they've considered as well. So you've got the different interventions in this first column, and they actually present the direct evidence with the certainty, the indirect evidence, and the network meta-analysis evidence as well. And you can see here they had moderate certainty for the direct evidence and low certainty for indirect. And what they've done is they've taken the highest certainty there, and they've used moderate for the results from the network meta-analysis. So this is just to show the impact of this particular review with network meta-analysis, and it was included in the WHO recommendations. So what do we do if a network meta-analysis is planned but not actually feasible? So the protocol, you may set out to plan for a network meta-analysis, but in the full review, because of the lack of studies or uncertainty regarding the transitivity assumption, it might not be possible to actually undertake one. We do recommend that the methods remain in the review in some format, so perhaps in the appendix, because if you do update the review and you find more studies, it may be possible to conduct the network meta-analysis in the future. So it doesn't matter that the review contains network meta-analysis, it should still follow a pre-published protocol, and it should still report the methods transparently and still assess risk of bias of included studies. I think the main difference is about presenting the findings accessibly, because of the amount of information in reviews with network meta-analysis. It's a really important point to think about when thinking about network meta-analysis. So these are just some resources. We've got chapter 11 in the Cochrane handbook. It's a really good overview of network meta-analysis. And Cochrane's Comparing Multiple Interventions Methods Group have their own website with resources, references on there. If you have a Cochrane account, there is an online module on network meta-analysis on Cochrane training. And I think it was a couple of years ago now, we organised a webinar series on network meta-analysis, and this is available for free on the Cochrane training website as well. So there were several webinars. One was on protocol considerations, one was on grade, one was on cinema, one was on the Meta Insight app that I mentioned, and then there was one on editorial considerations as well, and also one on disseminating the results of network meta-analysis. And also, if you are conducting a Cochrane review with network meta-analysis, please contact us at the Methods Support Unit, and we can advise and support as appropriate. And these are just some of the references that I've referred to in the presentation. Thank you.